Hello everyone, I'm Dr. Renee Mehrra. Thank you so much for joining Zoom in with Renee. Today's video is a very special one. It's a tribute to our unsung heroes. We salute to our nurses, our Florence Nightingales, who with their steadfast dedication and their commitment to their noble profession bring so much of tangible difference in our lives. Thanking you is not enough. So in gratitude always to all our nurses out there. This special program was done in collaboration with Indian American Forum. The honorees were given citations by Nassau County legislators of Long Island in New York. Guest speakers were medical doctors and community leaders. Let's take a look. Thank you so much for joining today for a very, very special webinar. It is a tribute and a salute to our unsung heroes, our nurses, who are there for us always, anytime, anywhere, to bring so much of, in this noble profession, so much of commitment and their unwavering support. So today, this is a tribute and a salute to all our nurses out here today.
And we salute these heroes who stand side by side with us. As a physician, where would we be without our nurses? And we always recognize them, and in particular this week, all because of Florence Nightingale.
Good evening, friends, our dignitaries, elected officials, Honorable Deputy Supervisor Ms. Gooseby, our presidents of all different organizations, our esteemed honorees. We want to welcome all of you for a very, very special webinar today in the honor of nurses. And on behalf of Indian American Forum, our board of trustees and directors, we want to welcome all of you today. And as we go on, we will be acknowledging the presidents of different organizations who are joining us today. As you know, our elected officials always are very, very busy, and our Honorable Deputy Supervisor from Town of Hempstead, Ms. Gooseby, was so busy this morning, and she made special efforts in joining us today because she herself was a healthcare professional, and she's a true friend of our community.
Nurses work very, very hard, and they do things that other people would not do. So we definitely should always make sure that we recognize them, make sure that we thank them, and just give them a good, kind word, because many times I've seen that they go into residence and so forth, and they're not pleased because the patients are patients, and they're not happy because they're there. But in the end, they can always say thank you to the nurse because they really work very hard for them. So I'm glad that this group has taken the honors and given them to people who really deserve it. So that goes for the doctors, and it goes for our nurses. And I certainly like to see female doctors as well. So I wish I had more time, but it's been a heavy, heavy week for me. I started out Saturday morning, we had the Boy Scouts, and they had their troops today. And even through that, we still had to go out. I was out in all that rain. It was a busy day. There is so much that we need to do, and there's so much that I have to do in my area as well. So even today, we had kids. I was with the kids today because they were having a contest on math, which was wonderful to see how they're doing. Yesterday, I was with the kids who are from 2 to 6 years old, who are concerned about bees. We always know, and it's great at this age, they're worried about it because we're going to lose them. If we lose those, we're going to lose a lot in our universe that we really need. So it was nice to see them at their age. They speak well, and they were wonderful. So there's so much that we have to do together. And because we need this country, that is our country, we want to be a part of it. And we just need to help others who do not realize how important it is for us to be able to do what we have to do and love each other. So I'm very happy to be here. I have attended many of the functions that Indu has sponsored. And so just keep her going because that's what's important. And I'm sorry I won't be able to stay because I do have so many papers here on this table now that I must finish before tomorrow. So God bless all of you and have a wonderful, wonderful program. Thank you again for what you're doing.
Thank you. Thank you very much, Mr. Gooseby, for your kind
Thank you, Ms. Gooseby.
Thank you so much. Okay, have a good evening. I'm sure it's going to be good. Thanks, Indu. God bless.
Let's go back to our schedule. We need to start with Ganesh Vandana.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। जय गणपति वंदन गणनायक, जय गणपति वंदन गणनायक। तेरी छवि अति सुंदर सुखदायक, जय गणपति वंदन गणनायक, जय गणपति वंदन गणनायक। Namaskar. Thank you very much. And you people are working very hard. And congratulations, because this week is the Nurses Week. I want to congratulate all of you. Thank you so much.
Thank you. Thank you. Thank you,
very
Renu.
much, Anuradha Khanna.
As we move on with the program, I met Tara Shahjahan, a very distinguished, accomplished nurse many years ago. And when I saw her bio, I could not even imagine how accomplished nurse she is. You will see her bio later on as we present her bio. You know, I don't want to read the whole bio right now. Currently, she is the treasurer of NINA, which is the National Association of Nursing, and also the director of nursing at Lincoln Hospital in Manhattan, in New York.
Good evening to all of you, and happy Nurses Week. And I really want to thank from bottom of the heart, from the INANI, from the NINA, from all the representing all the nurses throughout in America and in India and throughout the world. Thank you so much for acknowledging us during this week. As a nurse, when I am stand here, it is a pleasure to address all of you and my colleagues and who have joined here. I started my career in nursing in 1994, graduated from AFM as a bedside nurse. And now as an administrator, I still cherish those days as a bedside nurse. I want to say a few words on the importance of this Nurses Day. When we begin our nursing career, we have two important events during our story. That's the lamp lighting ceremony as we enter into the nursing profession. And the other one is the graduation ceremony when we walk out as a trained nurse to practice our profession. And these are the two times you take a Florence Nightingale oath. When we look into the history of nursing, nursing did not have so-called professional backup as we have right now. When Florence Nightingale came into the nursing, she was attracted by the need to care for soldiers. And that time, condition of nursing was very pathetic. And if you think about the doctors performing the surgery, giving the medication, and then the patients are left behind in the hospital, and if no care was given to this patient, how are the patients going to get better? And that was the calling what the Florence Nightingale had. Being very dedicated, well-educated, and reputed English woman, she moved by the compassion. I seen the suffering of soldiers, and also during the Crimean War, she came along with a group of committed ladies who moved forward. She trained them and went to take care of these soldiers. So why we call her as a lady with a lamp, it's very important to know. And we see in the history that when all the when the doctors leave for the day, and these patients who are wounded in pain after surgery or whatever the reason are, and they are in the barrack, or in the hospital at that time, we see this lady, that's the Florence Nightingale, the small lantern in her hand. She used to walk at the midnight through the corridors, and every wounded soldiers or in pain, when they see their face filled with happiness and smile when they see her. You can just have the mission in your mind that this lady going to each patient, standing near them and just looking at them and asking, "How are you?" Just asking a word, so that was the reason why she was known as a lady with a lamp. So every day she was seen in those dark corridors of the hospital walking with a lantern. And I wish that all of us will have that love and compassion in our mind. When we are taking care of these patients, we have to remember that we are committed towards these patients, because patient is a very important member of a family. And so I all never to take this profession lightly. Florence Nightingale has provided us a very good vision about nursing. Now, nursing is not just giving care to the patient, as nursing has gone into a different horizon itself. Now we do have nurse practitioners, educators, researchers, and administrators. Even now we do have many nurses who are representing, being a CEO of the hospitals too. I really want to congratulate each and every nurse out here for choosing this noble profession. I want to say, if we don't realize the calling, what is in you, I must tell you that we will not be able to prove ourselves as a meaningful nurse. My wish to all of you is to understand your calling and dedicate your life to service of humanity. May God bless you. Thank you. And thank you once again to the Indian American Forum and Ms. Jaiswal. Thank you.
Thank you very much, Tara, as always. And as you rightly said, Florence Nightingale created new pathways for our nurses. And right now, you, all nurses out here, and those are joining us and those are going to be joining us later on social media, and when we put this program out, you are going to be creating the pathways for the future as well, for the next generation. So thank you once again very much. And keep that great dedication and commitment going, because we need you. You're always
Thank you.
for us. Thank you.
Thank you.
Our next speaker is going to be Dr. Rajiv Johar, who is Chief of Cardiology at North Shore University Hospital.
I'm sorry, I'm actually driving to the hospital right now to do some procedure. But, you know, the nurses are the backbone of the healthcare team, period. And, you know, when I was in medical school at the University of Chicago and then residency at UCSD in internal medicine, I learned the most from nurses. I learned at a very early point in my career that when you listen, when a nurse says something about a patient or is not comfortable doing something with the patient that you are recommending, take a deep breath and listen to him or her, because they are usually right. And now, as I've grown older, after my training in New York Hospital and then now working at North Shore LIJ for the last 22 years, the nurses are a tremendous part of our team, and they work selflessly to really help. And so I'm really happy to be part of this webinar, because we need to highlight the importance of the nurse. Because without them, I'm telling you, there'd be so many issues and so many complaints and so many problems. They really serve not just a function in terms of medical care, but emotional care, which is so important in the care of the patients. My nurses in my hospital are so very, very important. And so I want to thank Indu and the whole team for inviting me, because I think you could not have chosen a more important group to honor. Thank you.
Thank you very much, Dr. Rajiv Johar, for taking your time out even while you're driving. So please drive safely. Thank you. And now we have a legislator from Nassau County, Rose Walker.
too want to thank you for taking this time to honor all of our nurses. And, they truly are, I feel like, the backbone of medicine. We all want to have the best doctor. We all want to have the best treatment. But, the nurses bring about that personal touch. And, sometimes in medicine that's forgotten. Like I said, we always want to have the best care. And, but sometimes it's those little added things that really make a difference for everyone, not just the patient, but for the patient's families. And, it could be the most wonderful time in your life. You give birth to a baby, or your daughter or son has a baby, and it's wonderful and exciting. But it's also very difficult times when people are extremely sick, or maybe, this is the last days of their lives. And those nurses make such a difference for the patient and for the families. And I can't thank them enough for that. I look back during the COVID times, the worst COVID times. And, I always feel that in the medical profession, doctors and nurses, they sometimes have to, put up that wall so they don't get too connected. And, because things go good and things go bad, and you to have to deal with that on a daily basis is very, very difficult. But during that time, our nurses became our families. They were the ones who were there. They were the ones holding up an iPad or a phone, so that loved ones could see their loved ones, and perhaps it was the last moments of their lives. And what a difficult time for our nurses to have to face during that. Face is just, I cannot thank them enough for that. And like I said, to honor them, to take time to say thank you. They truly are sometimes I feel like the most personal part of medicine that we could have. And when I speak sometimes over at VEEB, at our at vocational school with our nurses, and I remind them that I said, don't ever forget the personal side of nursing, because that is so very, very important. Oftentimes we say, oh, this person doesn't have the best bedside manner, or this doctor doesn't have the best, but it's the nurses that give that personal touch. And it is so very, very important. I went through a major cancer surgery, spent a lot of time in the hospital, even, at the infusion centers, or doing this or doing that. And those nurses were, the lifeblood of the place. And they really made such a difference in my life personally, and in the life of my family, because it was a very difficult time for all of us. And like I said, they truly, truly made the difference. So don't want to downplay our doctors. They are absolutely wonderful. But our nurses really hold a very, very special place in my heart. And I know a very special place in the hearts of many of our community members. So Indu, I want to thank you so much. Doctor, I want to thank you so much for being here tonight. And you, and I am here for you always, just as I know you are here for me. God bless you all.
Thank you very much, Ms. Rosemary Walker. Thank you.
We want to thank Ms. Walker because we have citations from the Nassau County Legislature.
Thank you once again.
Yeah.
And yes, you're
All right.
right.
Thank you.
A personal touch nurses do provide, and they've always been there. So once you see a nurse, you feel
Yes.
the comfort zone there right away. So thank you.
Absolutely.
Over now to Dr. Urmilish Arya, who's the co-chair and trustee of the Indian American Forum, and of course a great community leader.
It marks the anniversary of Crimean War and the most famous Florence Nightingale's birthday. In fact, May 12th is the birthday for Florence Nightingale. Entire month of May, week, all day, and we honor them by providing hot lunches in the hospitals, watering their plants, or you can take their pets for a walk to show the thanks for their hard work and dedication. Someone said nurses are the heart of the healthcare. They dispense comfort, compassion, and caring without any prescription. And I'll quote Florence Nightingale, "I attribute my success to this. I never gave or took any excuse." So thank you very much. Happy Nurses Month, Nurses Week, and Nurses Day. Back to you.
Thank you very much, Dr. Arya. And we want to show Tara's citation. Dr. Bhavani, you want to do that? Go ahead.
Yeah. Tara Shahjan. She's the director of nursing, Lincoln Hospital in New York City, in Health and Human Center. Tara Shahjan was born in Pondicherry, India, graduated BSc Nursing from the Armed Forces Medical College in Pune, and was commissioned into the Indian Army as lieutenant in 1994. She served the country for 4 years, completed her private pilot license, and has 200 plus hours of flying. All right. Bravo, Tara. After marriage, she joined her husband at Abu Dhabi and also worked as a lead controller and flight dispatcher at Abu Dhabi Airport. She migrated to New York in 2004 and worked as an RN and progressed into leadership experience in healthcare services across the continuum of care. She graduated from Grand Canyon University with a master's in nursing leadership and an MBA in hospital administration in 2017. And subsequently, Theophany University awarded Doctor of Philosophy honorary in humanitarianism in 2021. Ms. Shahjan currently works as Director of Nursing at Lincoln Hospital in New York City, and she's a senior seasonal adjunct professor at LIU Post. She is a member at UPNA, AONL, ANA, as well as STTL, and she's currently the treasurer for the National Association of Indian Nurses. She's active in various community services in both US and in India, and she's been nominated as Woman Vigor Award by Claire's Walters Society. She's received many, many awards from the community and for her professional achievements. So I give you our nurse, Tara.
We're going to go on to our second honoree now. And our second honoree is Mrs. Sudha Bala Sharma from Nassau County. Mrs. Sudha Bala Sharma is the founder of 3 community projects that started 19 years ago. She started the annual food drive for Long Island Soup Kitchen and homeless shelters in the basement of her own house. She collected medicines and medical equipment from Long Island physicians, dispensing to those individuals who have no insurance coverage at the Holy Patterson Nursing Home in Uniondale. With a penny project, Sharma's foster children, she collected pennies and gifts for donation to foster children during holiday season. She also raised funds for Safe House and Bethpage, a program for battered women and their children. The greatest reward for volunteer experience is bringing light into the life of those who are less fortunate. And that's what nurses do, and that's what she's doing all along. So thank you very much, Mrs. Sudha Bala Sharma, for all your contribution to society and to the nursing profession.
I graduated from London, and then I worked in Africa. And my experience in that, I have to share with you that I gave 40,000 injections. There were 8 people working under me in 6 weeks because there was a big exodus from Nairobi, from Kenya, those who didn't have the citizen, and the Britain was closing the door. So we had to give all those injections to those people. Some of them were lining up for hours. And this is what was the best experience. Besides, when I came here, I worked.
Right. Thank you so much. And congratulations.
Thank you.
Can I just read like one sample citation? Is it okay?
Yeah, go ahead, please.
Okay, this is from the Nassau County, from Mr. Bruce Blakeman's office. The County of Nassau is proud to recognize those outstanding individuals who render significant contributions for the enhancement of our region and the betterment of our residents. And Sudha Sharma, RN, is such an individual. The nurses have worked diligently on behalf of causes and ideals which uphold the principles of human decency and through the years. And they have demonstrated selfless commitment to the county of Nassau and its residents that warrants attention and gratitude. So all the citations have the same wording, and this is in the honor of the nurses given by our Honorable County Executive, Mr. Bruce Blakeman. And also from the Nassau County Legislature, from Ms. Walker's office, similar citation we have. Okay.
Now, our next honorary, Shreya Bhatkar studied nursing at the Sion Hospital in Bombay, and she earned her BS in Public Health Nursing in Delhi. She received her operating room training at Sloan Kettering in New York and went on to work in various hospitals and nursing homes in the New York area, serving as a supervisor at Little Neck Nursing Home. The passion brought Shreya to a career in nursing home through in a community service. As well, over the past 25 years, she has been a pillar of the Indian community, playing key pivotal roles in various organizations. She was formerly the cultural chair of the Indian Association of Long Island and has organized forums for seniors and women as well as food drives. For the last 25 years, Ms. Shreya has conducted many events in her capacity as cultural chair for the Indian American Forum, including founding of International Children's Day. And she continues to work with seniors through India Home and is also the vice president of the National Indo-American Association for Senior Citizens. Shreya is also the cultural chair of the South Asian American Political Committee, coordinating a variety of events under their banner. She was appointed as vice president of the Maharashtra Mandal, New York, and has also received the honor of being recognized as a woman of distinction in March 2019 by Assemblywoman Michelle Solages. Congratulations, Ms. Shreya Bhatkar.
I had a very good time with nursing. I enjoyed. I did a lot of good work for people. I gave a lot of compassion. I really dedicated myself to the nursing. I enjoy my nursing. I'm so proud to be a nurse. Thank you.
We're proud of you. Thank you very much. Congratulations once again. I also want to mention that we will be having a Q&A session. So if you have any questions, please do put them in the chat. And then we will take them after we've done with the honors of our nurses. Now, our next speaker is going to be Dr. Jagdish Gupta, who is the president of Association of Indians in America, New York chapter.
First of all, congratulations to Renee Mehrra ji. I'm seeing her after a long time, as you said. And thank you for organizing this forum, Induji. It is a great week. So National Nurses Appreciation Day or Week should be celebrated every day and always, I pay tribute. A lot has been said already by the last many speakers, but I pay my gratitude for all the nurses for their compassion, dedication, and expertise. That makes a remarkable difference in the lives of countless patients every day. Nurses, of course, are integral part of healthcare team, spending maximum time with the patients and their family. A physician comes in, sees the patient for a few minutes, depending on their situation is, but nurses in the healthcare team spend the maximum time, and many people have attributed that trait to the emotional support to the patient and family. And they are very integral part of the fabric of patient care. I want to thank you again for your unwavering commitment for providing exceptional care. You are the true heroes in every sense, especially during our COVID time. Both physicians and nurses worked hand in hand to take care of the most vulnerable population of the patients. Today and every day, We honor and celebrate you. You are and we deeply appreciate your contribution to our healthcare team. Thank you very much. I want to thank Taraji. I want to thank Sudhaji, whom I have known for many, many years, Jayaji for many, many decades. So it's been a nice, event for me to be here and see this thing happening. And thank you everyone who is present here, and congratulations to all the nurses on behalf of the Medical Society of County of Kane, American Association of Physicians of Indian origin, as well as the Association of Indians in America, the oldest ethnic organization of Indians. Thank you.
And thank you, Dr. Gupta.
Thank you, Dr. Gupta. That was very well said. We always appreciate our nurses when they stand with us shoulder to shoulder. And can I now call on Mr. Gobind Munjal to say a few words in support of Nurses Week? Mr. Munjal is current president of National AIA, and he's past president of India Association of Long Island.
Thank you, Bhavani ji, introduction. And thank you, Renee ji and Indu ji, for organizing such a beautiful function, because nurses really need appreciation. So I'm Govind Munjal, and I'm the National President of Association of Indians in America. See, generally, May 6th is a National Nurses Day, an annual opportunity to appreciate the nurses in our lives and remind ourselves of the innumerable ways they contribute to our health and the well-being of those we love. People have celebrated nurses for decades, but it wasn't until the 1980s that the United States honored these integral healthcare professionals with their own day of recognition. National Nurses Day is the first day of National Nurses Week. 2023 Nurses Week theme is Nurses Make a Difference. Anytime, anywhere, always. Nurses work each day to ensure patients get the care they need. The complex nature of nursing continues to be physically and emotionally draining. Yet, nurses carry on providing quality patient care and moving the profession forward, which reinforces the importance of nurse appreciation. Nurses need to be emotionally, psychologically, and morally refueled regularly to enable them to resist burnout and its many negative impacts, such as moral distress. One way to do this is through expression of gratitude. This is why nurse appreciation events are so important. Nurses' contributions are celebrated and recognized each year, as they should be, through special nurse appreciation days, weeks, and months set aside to honor nurses and their specialties. I must thank and congratulate all the honorees, Taraji, Sudhaji, Jayaji, and all the nurses present here. And thank you everybody for giving me an opportunity to speak here. Thank you.
Thank you very much, Mr. Munjal.
Introduce to you our next honoree, Grace Alexander. So Grace Alexander was commissioned from MH Secunderabad as lieutenant and midwifery from INHS Ashwini. After a few years of work in medical surgical floor, she resigned from MH Danapur. She then worked in a university hospital in Saudi Arabia for 15 years and migrated to the US in 2006. She has 20 years work experience as a medical surgical nurse and 15 years as an operating room nurse. She completed her BSN, MSN, and CNOR and is also a lifetime member of INANY and AORN. Currently, she is Awards and Scholarship Chair in INANY in 2021 and 2022, and a member in the current scholarship committee. So congratulations, Grace Alexander.
Thank you. Thank you so much. And it's an honor for me to have this. And Tara just asked me to write something about me. I just gave a short note. I just came back from work and I love being a nurse. Thank you so much for honoring me.
I have a quick question for Grace. Which city in Saudi Arabia did you work in as a nurse?
Riyadh.
Ah, okay, because I lived in Riyadh for a couple of years, so.
Oh, I was there for 15 years. Thank you.
Over to you, Renee.
Okay. We have Sandy Bhatia from Flushing Savings Bank. Sandy, would you like to say a few words?
Good evening, everyone. This is Sandy Bhatia, and thank you so much, Renee, for this really Nurses Week. Congratulations to all the honorees, and really proud of. I have one of my very dear friends. She's a nurse, and I know how hard she works. And all of you guys probably really working so hard and helping, patients and people who needs help. So I thank you so much from bottom of my heart, and we are very proud of all the nurses that help, the patient. Thank you so much.
Thank you, Sandy Bhatia. And over on to our next honoree, it's Suja Madhu. Congratulations, Suja Madhu. She studied nursing in India and is a nurse for 40 years, immigrated to US in 1987, and started working as an assistant nurse manager since 1992 at Northwell. Back then it was NSUH. In 2008, Suja Madhu transferred to Zucker Hillside Hospital and continued to work there still. Suja has been recognized as the Nurse of the Year Award for 2023 by Northwell Health. Suja is 40 years in nursing and still working and going strong. Thank you, Suja, for your die-hard commitment. You're a true blue friend of the community and of all the patients. Thank you. Congratulations.
Unfortunately, she has to step out because she's working.
Okay.
And
so do you want to speak on her behalf, Tara?
Yeah, sure. She joined us, but she has to go back. Thank you. Thank you.
Thank you very much, Tara. Do you have any questions for our honorees and for our guest speakers?
I just wanted to mention one more thing about our honoree Jaya Bahadkar, because she's been a tireless community worker. Anytime anybody needs something, she's always there. Not only in the capacity of nurse, but also as a guide, philosopher, and friend for whoever needs it at that point.
I have my colleagues also has joined, Dr. Shaila Roshan, Dr. Solimal Kurula. They all are our nurses who have joined us. Thank you so much. Solimal is here too.
Month, every nurses out there, thank you so much for everything that you do. I am Dr. Shaila Roshan. I currently work as the Director of Nursing at King County Hospital. I love being a nurse, and that's like it's core to my heart, so thank you everyone for I congratulate everyone who coordinated this. This is wonderful. Thank you.
Thank you very much, Shaila.
And what about Esther?
This is Esther Devadas. Happy Nurses Week to everybody. And I'm working in North Central Bronx Hospital. It's also part of New York City Health and Hospitals. I'm actually managing the med-surg units and moving to be the nurse educator in Jacobi Hospital. That is also part of New York City Health and Hospitals. I had my experience back home in India as a nurse educator as well, almost 8 years. And so happy Nurses Week to everybody. And we work really, very hard. And God bless us all.
Thank you, Esther.
As Rose Walker and Dr. Urmila Sharia said, nurses are the heart of the healthcare. And every nurse is an angel with the key to healthy community. as I always say in my style in Hindi, so I just wrote few words. अपने कर्तव्यों के प्रति निष्ठावान, अपने कर्तव्यों के प्रति निष्ठावान, जो सबका रखे पूरा ध्यान, कर देता है दूर सब दर्द, उनके प्यार का स्पर्श, यही है उनके प्रोफेशन का आधार. हम सब उनका बहुत बहुत करते हैं आभार, सब उनका बहुत बहुत करते हैं आभार. धन्यवाद.
Very well said. Thank you, Anjuji.
Thank you very much, Anjuji.
Mr. Raju Abraham, he is one of our community leaders. He has joined us also.
You know, I see our friend Nalini Das is there. Nalini, would you like to say a few words?
Congratulations to all the nurses. I know Nightingale, and I have family members who are nurses and physicians, and it's a joy to be with the group. You know, Indu never forgets me. For years we've been working and retired. Congratulations and thank you to be invited to take part in this celebration.
We have honored our nurses today. Congratulations again to all of you. Very well deserved. You all are pillars of the society and pillars of the hospitals in which you used to work, and those of you who are continuing to work, you continue to uphold the traditions which Florence Nightingale did start. Thank you. We are very grateful. As a physician, I can say I'm very grateful to all of you. And I'm sure all of your patients echo my sentiments.
Thank you. Like your sentiments, Dr. Bhavani, they are pillars of our healthcare industry and pillars of our community and indispensable pillars. So thank you once again to all the honorees and to all the nurses out there as we celebrate today, a special day. I'm Dr. Renee Mehrra. Stay healthy, stay positive.